The world is panicking over a new coronavirus variant. What is Omicron? Are countries overreacting, and are they following politics more than science? Welcome to America Uncovered. I'm Chris Chappell. Just so you know, YouTube is secretly unsubscribing people, and they're not telling you when new episodes come out, so be sure to check back every Tuesday, Wednesday, Thursday, and Saturday for new episodes. Just when you thought it was safe to hang out with your friends again, it turns out you have no friends. But if you did, there's bad news. We're stuck with another coronavirus variant. Again. Coronavirus has had more reboots than Batman, each one darker and grittier than the last. And no, I'm not talking about the Delta variant. I'm talking about the Omicron variant. Omicron sounds like a racial slur for Transformers. Grandpa, you can't call them that anymore. But it's actually just the 15th letter of the Greek alphabet. Yeah, it just looks like an O. It would have been called the new variant, but the WHO skipped that one because it could be confusing, and feared that it might lead to a revival of new metal, which would be an even worse plague on humanity. The next letter of the Greek alphabet would be Xi, which is spelled XI. But the WHO decided not to call it the Xi variant either, and that led to speculation about whether Xi was avoided in deference to the Chinese president Xi Jinping because it's spelled the same way. After all, the WHO and Xi Jinping are good friends. Considering how he treated them during his administration, I'm surprised the WHO didn't name Delta the Donald variant. That'd be appropriate since it's all CNN talked about for months. Anyways, the Omicron variant was first widely detected in South Africa. That's not to say the Omicron variant originated there. It's not clear where it started. It was first identified at a lab in nearby Botswana at the beginning of November, but it's spreading fast.
In the Netherlands, 13 cases confirmed today among passengers on 2 flights from South Africa. New cases also confirmed in Australia and Denmark, adding to a growing list that already includes Hong Kong, Italy, Germany, the UK, and Belgium.
It was just discovered and it's already everywhere. This variant is just like Olivia Rodrigo, because everyone's saying it's a big deal, but I hardly know anything about it. So what is the Omicron variant? The World Health Organization calls it a variant of concern. That means there's evidence of at least one of these 3 things. It spreads faster, it makes people sicker, or it's more resistant to the vaccines. A virologist at Warwick Medical School said it is the most heavily mutated version of the virus we have seen to date. This variant carries some changes we've previously seen in other variants, but never all together in one virus. The variant has 50 mutations overall and 32 in the spike protein. That's the part used to penetrate cells and the key target of the majority of vaccines. In comparison, the highly contagious Delta variant only has 18 mutations on the spike protein. The Omicron's a mutant with a bunch of spikes, so it's basically Wolverine. Only Magneto can stop it. Some worry that Omicron's mutations could allow it to evade antibodies produced through vaccines or prior infection, but we don't know for sure that it spreads faster, makes vaccines less effective, or whether it leads to more severe disease, or if its bones are made from adamantium. Dr. Anthony Fauci, head of the National Institute of Allergy and Infectious Diseases, told President Joe Biden on Sunday that it will take 2 weeks to have definitive data on the Omicron variant. And according to the director of the National Institutes of Health, it could take several weeks more to figure out whether vaccines are effective against it. What we do know so far is that the symptoms are unusual but mild. Unusual but mild. Kind of like a nostril fetish. Don't know why that's your thing, but it's not hurting anybody, so you do you. According to the South African doctor who detected the Omicron variant, her patients exhibited symptoms including fatigue, body aches, and a recurring dry cough. None suffered from a loss of taste or smell. Even the ones who enjoy new metal, since they never had any taste to begin with. This, according to her, should not make us panic.
looking at the mildness of the symptoms that we are seeing, currently there's no reason for panicking as we don't see severely ill patients.
Many other medical experts, including the director of the National Institutes of Health, say there's no reason to panic. No reason to panic. That sounds like a TikTok challenge. And that challenge was accepted. More after the break. Welcome back. So with an unknown coronavirus variant now making headlines, a lot of people are beginning to panic. Although as of this recording, the Omicron variant hasn't been found in the US, that hasn't stopped New York Governor Kathy Hochul from declaring a state of emergency. Which seems a bit rash, but at least this policy won't kill thousands of grandparents, like Andrew Cuomo's policies did. Still waiting for him to face any consequences for that. Dr. Fauci says it's not if Omicron comes, but when. Could it be worse than the Delta variant? Some headlines say it's already the worst variant we have come across. We've got to prepare for the worst. And thank God for this new variant. We needed something sensational to drive up ad revenue. Wait, did we say that out loud? You gotta love the Puffington host. Fear of the worst is getting many to panic in a race against time. Within literally hours after the South African health authorities announced the discovery of the Omicron variant, countries including the US, EU, Canada, and Australia moved to block flights to southern Africa, stranding hundreds of passengers without warning. This includes bans on travel from these 8 countries. Other countries like Japan and Israel are imposing bans on all foreigners. This is setting a dangerous precedent, mainly for some Republicans who now know they can just announce new types of COVID to halt immigration. Look, it's the Build the Wall variant. The Africa Centers for Disease Control and Prevention strongly discourages travel bans. Instead, they say implementing public health and social measures should be prioritized. The World Health Organization agrees. As a growing number of countries have imposed flight bans on southern African nations due to concerns over the Omicron variant, the UN Health Agency urged them to follow evidence and international health regulations, calling for borders to remain open. This advice is being ignored by a lot of countries, mainly the ones taking the panic immediately challenge. And that may have to do less with science and more to do with politics. I'll explain more after the break. Welcome back. The moment South Africa announced its findings of the Omicron variant, many countries imposed travel bans on it and neighboring countries. This upset a lot of South Africans, like Elon Musk, who'll probably make a cryptocurrency about this. Omicron is getting around your national travel bans by going to the moon. People feel South Africa has been punished rather than applauded for detecting the new variant, which is only going to encourage countries that find new variants in the future to cover it up, like the person in every zombie movie who gets bitten but doesn't tell the rest of the group. According to the South African Foreign Ministry, the travel bans were akin to punishing South Africa for its advanced genomic sequencing and the ability to detect new variants quicker. Punished for being honest and doing an excellent job? I can relate. The South African president described the bans as baseless discrimination. He said, "These restrictions are unjustified and unfairly discriminate against Southern African countries. The prohibition of travel is not informed by science, nor will it be effective in preventing the spread of this variant." Malawi's president also criticized the travel bans, saying they were uncalled for and based on Afrophobia. And he's not talking about a fear of large, funky hairdos. These travel bans have shown a lot of inconsistencies that point to that direction. Despite South Africa having a low number of COVID cases, other countries with higher numbers of cases, like Germany, haven't been banned. A lot of people feel this inconsistency is unfair.
We've been doing this for close to 2 years now. And one thing we know for certain, travel bans, especially when they are performative in this way, target a few countries and not others where we already know the variant has already been isolated, like in the UK, are ineffective. But not only that, when done in this way, all they do is perpetuate stigma and xenophobia. And then for South Africa and 7 other African countries to be targeted with travel bans when other countries that we know of right now have the same variant is completely unacceptable to me.
Some medical experts are warning against travel bans, saying that this is a bad signal to other countries. If you identify a variant and share it with the global community, you will be punished with a travel ban. Seriously, has no one ever seen a zombie movie before? And travel bans might not be very effective anyway at this point, given how globally the virus is spread. According to the director of the Yale Institute of Global Health, there is very little utility of these kinds of bans. They're not effective and only there to give a false sense of security. So basically, travel bans are just like the TSA. Studies from the journal Science and Journal of Emergency Management suggest that travel bans could have some effect, but mainly in delaying the spread. And the downside is, introducing a travel ban can also give a false sense that the virus is being contained. According to a professor at the University of Washington, a travel ban could, in theory, buy some time by reducing the spread of new seed cases, but we're talking on the order of days to weeks. Many medical experts say it might already be too late to stop Omicron. We'll just have to do our best to mitigate the damage and live with it. Kind of like people suffering from Afrophobia. Government policies also tend to be quite inconsistent. This is where politics matter more than science. For example, a lot of countries treat quarantine differently for their own citizens versus foreigners. An associate professor at the University of North Carolina calls this pandemic theatrics. After all, why ban or quarantine some but not others? Does a virus really care whether you're a citizen or not? And why ban some countries but not others if they all have the same variant? This is like putting a travel ban on America since it's the birthplace of Olivia Rodrigo. She's already everywhere. There's nothing we can do. According to a researcher of pandemic border policies, it is unlikely that the current round of travel measures being reimposed will do much to prevent the spread of this variant of the virus. But what the selective travel bans will do is hurt the economies of any banned countries, especially poor countries in southern Africa, who won't be able to invest in Elon Musk's Omicron. So what do you think? Leave your comments below. And if you like this show, please know we could not do it without direct support from viewers like you. Visit patreon.com/AmericaUncovered and contribute $1 or more per episode to help us keep the show going. So click the link below. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.